Hi, I'm Anthony Patterson in Gail Davern's English 104. I titled my presentation Tweaking. It's about the hardships of methamphetamine addiction and recovery. First, I wanted to take a second to introduce methamphetamine. Now, methamphetamine is a powerful stimulant. It directs its attention to our neural networks in our brain and our spinal cord. More specifically, the neurotransmitter dopamine, which is a factor in our natural reward system. Methamphetamine is a Schedule II narcotic, meaning it has some medical uses, but there's a lot of risk of abuse and addiction. Methamphetamine is a synthetic drug that's made in a lab. Production is a pretty easy process. It has there's thousands of different recipes out there, but they all pose the same hazards like toxic waste, fires, and explosions. Those who take on the production risks of methamphetamine are referred to as cooks. The average cook shares his manufacturing methods with 10 individuals a year, keeping the production a continuously growing concern in the United States. The reasons people start smoking meth vary. After the first time, users enjoy the effects like euphoria, increased alertness, increased physical activity. They last for hours. But later, when you start to come down, the euphoria turns to paranoia and irritability, anxiety, aggression, insomnia, hallucinations, and there's other symptoms of withdrawal, like an intense depression from the lack of dopamine in your brain. So in an attempt to feel normal, the body is going to begin demanding more meth, and this creates a pleasure tension cycle for the user, where the user starts to use more frequently to avoid the come down, overall losing control over the drug and addiction. Now, I want to define addiction for you. The Diagnostic and Statistical Manual of Mental Disorders, 4th edition, is a diagnostics reference book that uses the term substance dependence to define drug addiction. The best way I can define substance dependence is continued use of any substance undeterred by negative effects on health, behavior, or other important aspects of daily life, and being unable to stop using. Addiction is a word that gets passed around far too casually in conversation, like I'm addicted to chocolates or soap operas are so addicting. But addiction is a disease. Now I have a quote from drugabuse.gov. The chronic nature of the disease means that relapsing to the drug is not only possible, but also likely, with relapse rates similar to those of well-characterized chronic medical illnesses such as diabetes, hypertension, and asthma that also have both psychological and behavioral components. So it shows me that type 1 diabetes, you have a 30 to 50% chance of relapse. Drug addiction, you have 40 to 60% chance of relapse. Hypertension and asthma both are 50 and 70%. So it's a high relapse rate. Next point I'd like to go over is treatment. I'm going to go over two forms of treatment. There's the pharmaceutical form of help, and then there's inpatient and outpatient behavioral therapy programs. So first, there's the pharmaceutical form of help. The FDA hasn't approved a method of detoxing from methamphetamine like you can from alcohol or heroin. But there has been recent medical investigations showing that there are some medications that can provide quick relief during withdrawal from meth. The problem is these medications are also narcotic and have a high risk for abuse and addiction. Second, there's the inpatient and outpatient programs for behavioral therapy. Now, therapy works to motivate the individual to participate in treatment activities, teach coping methods for drug cravings. The behavioral therapy promotes how to avoid drugs and prevent relapse, how to cope if relapse does occur, and it helps you make improvements on communication, relations, and family dynamics. I also want to go over the hardships of recovery from methamphetamine dependence. So with the draining of dopamine in your brain, you're left with a chemical imbalance that takes a long time to heal itself, from 6 months to a couple years to get back to normal. There's also the leftover wreckage of life after addiction. Meth addicts, because they crave the drug so bad, generally lose control over their lives and everything. Just like any other addiction, you're left with very little or your shattered remains of life. When those are paired together, you're trying to fix the wreckage of life. You get a severe depression or lack of emotions that lasts as long as the chemical imbalance does, 6 months to multiple years. Some addicts have a mental illness that they're coping with by using methamphetamine, or some addicts use methamphetamine and end up with a mental illness similar to schizophrenia and use to cope. And these oftentimes are a hardship in methamphetamine recovery because treatment has to treat both the mental illness and the addiction at the same time, or you're not getting proper treatment. And another hardship is getting to know yourself again and reconnecting with family, work, and the community in a positive way. So with relapse rates for drug addiction in the 40 to 60%, we can assume recovery from any addiction is going to have its challenges. But meth addicts, on the other hand, they face hardships like severe depression or loss of emotion for monumental lengths of time. And when you pair that with the stress of rebuilding a life of recovery over the tattered remains of addiction, it adds to the depression, leading to believe that the hardships meth addicts face in recovery increase the chances of relapse and a return to active addiction.